Our first item here, we have an update from Mr. Bill Webb, our health officer here in Kent County, and Wayne Darrell, the Director of our Emergency Services. So Mr. Webb, the floor is yours.
Thank you, Commissioners. I want to thank you for the opportunity to come and present to both you and the community as a whole who are attending remotely. The process of reopening in our state continues. Many of our large population counties in the central part of the state continue to have stricter stay-at-home orders than what the governor has currently mandated. In Kent County, we're doing a little bit better than that, and we are following the governor's guidelines, and I anticipate that he may make an announcement in the near future moving in the reopening direction. Of course, the new normal will involve social distancing, face masks, and hand sanitizer for the foreseeable future. Face coverings are a particularly unpopular item, and I anticipate that they will soon become optional rather than mandatory. I do want to take this opportunity to remind everybody that the SARS-CoV-2 virus remains embedded in our community. Reopening does not mean that this virus is behind us. I encourage all not to become complacent with the practices that have kept us safe. I anticipate our infection numbers to climb with increasing social interactions. The virus will have new hosts and avenues for spread. I'm particularly worried about faith-based communities and their high-risk patrons.
Unknown participant is now joining.
Youth camps are also a high concern for me, but at this time they are not permitted, they're closed at this time, they're not permitted to operate. So I want to run quickly through some of the numbers and then talk about some reopening activities and the 4 pillars. I know that you have a packed agenda today and want to be as brief as possible. Currently, the Kent County case count is 155 positives. We have had 14 deaths of Kent County residents. The total number of people who have been tested as of May 22nd is 895. This represents 4.6% of our population, and this is the 3rd highest testing rate in the state. Of those who have been tested, 16.3% of those are positive, and that compares to 19.5% case-wide. We're still dealing with outbreaks in our nursing homes. I'll run through this quickly. The peak at Peak Healthcare in Chestertown, which formerly was known as Autumn Lake, has had a total of 77 positive cases. 59 were residents.
Is now joining.
18 were employees. We've had 18 deaths there. Of those 77, 48 have resolved and recovered. The resorts at Chester Manor, we have a total of 40 cases. 30 of them are residents, 10 are employees, and we have had 10 deaths there. The outbreak at the egg processing farm is no longer considered an outbreak. All of those individuals who were tested and tested positive their situation has resolved, and they are, that business is continuing to operate it's continuing to operate with the safety measures that have been implemented, but at this point it's not an issue any further. On to the 4 pillars. Okay, personal protective equipment. Kent County agencies at this point have been able to procure PPE successfully on the open market. That has changed since we last met. Unfortunately, the lead times for commercial procurement are about 4 to 6 weeks. So you can get PPE on the open market, but you have to order it well in advance of your need. The health department has been able to scale back its role in the community providing PPE. We're providing sort of stopgap supplies for our healthcare partners as they need it, as they're waiting for their supplies to come in. This is all good news. Our healthcare partners are still using aggressive PPE conservation practices, And we could have shortages flare back up again if our case counts go up. So, we have an inventory, and emergency services has an inventory of PPE that we can throw into the mix if it's needed in short order. We have a supply. One of the big announcements today involves the testing activities in the community. The regional 5-county testing site at Chesapeake College is closing on June 5th. On June 8th, the Kent County Health Department will be standing up its own testing site at the County Roads Building. Testing will be very similar to the way it works at Chesapeake College. It will require an appointment and a physician's order, just like the regional site. Tests for preoperative clearance, or those for human resources, business requirements, we're not going to do those. We want to prioritize our testing capability for those who have been exposed or who may be sick. The testing will happen Mondays and Wednesdays. This is tentatively Monday and Wednesdays from 9 to 12, and our testing efforts will be time limited. I envision doing this for maybe a month or 6 weeks, and in the meantime, getting the private sector testing, the providers and the hospital and the labs to bring their capacity up to speed in the interim. I'm anticipating that we'll need to test for about 50 to 60 tests a week, and we will also be available if outbreaks occur or if we identify hotspots in underserved areas of the county. So the good news is we have testing kits. The health department, through the Maryland Department of Health, has been able to procure testing kits and capability that previously was lacking. And we are going to step into the breach and provide the testing needs on a short-term basis. And so that's going to be a fairly significant change for the health department. To talk about the hospital surge capabilities, really at this point there have been no significant changes with University of Maryland Shore Regional Health at Chestertown in the last 2 weeks. They have been operating within their normal capacity, and one important thing to note is that their ICU bed vacancies have been very limited. So, Shore Health ICU bed vacancies in the last week have been, they have been, full most of the time. And so, if that's needed,
Unknown participant is now exiting.
if that level of service is needed, I think they have been transferring some of those patients up to Baltimore. They have not needed to dip into their surge capacity. They do have the ability to surge their ICU beds, significantly from their normal capacity, but they have not needed to do that at this point. At least that's what I understand. They have resumed elective procedures, and they're doing that on a relatively slowly, as they figure out their new way of operating.
Because I put that cleaner in it, honey. Hold on. I put cleaner in it.
We would just ask the people who are watching this remotely to please mute your phone. Thank you. Okay, our contact tracing. That's another one of the pillars that we have.
3 participants are now joining.
Welcome, everyone. Okay. Contact tracing now is a 7-day-a-week job. We have, we're in the process of getting new hires to be deployed on the weekends and oriented. The statewide call center for contact tracing will be going live by the end of the week, and the health department is having training now as we speak with our communicable disease nurses on the new IT database system that has been put into place. And just like at our last meeting, contact tracing really has shown that this virus is being transmitted either through occupational exposure, people at work, people in the nursing homes, or from household, someone in the household gets it and then it's transmitted to another member of the household. Of course, this will likely change as the community reopens. So we're keeping a close eye on those numbers. I wanted to talk about generally the CARES funding that we're working with you, to deploy into the community. It's about, for those who are not aware, who are watching remotely, it's about $3.3 million, and it came from a federal source.
Jenna Christensen Lewis.
Is now joining.
A federal source, and so where we are with that is the health department and the county commissioners, we've finalized our general plan and the forms that we want to use for that. We still need to work on some of the mechanics of the requests and the approval and the payments. We still need to have an information session for our recipients and stakeholders, not necessarily you guys, the county, but for all of the towns, so we can help them identify what's public health spending and what's non-public health spending. We need to prioritize our high-cost projects so that we can get them in the pipeline, because we know that we have to have the money spent by December 30th, and that means that the projects have to go through procurement and build out or whatever is needed. So we had a working session, I think, last week about this. It was very productive, and I would certainly be available if we need to schedule another working session to move forward with the CARES funding. Okay, now I want to talk about some of the health department activities. I want to give an update on the AF Whitsitt Center. The AF Whitsitt Center has essentially been closed since March 17th. We hope to have it opened in late June or early July. One of the problems that we have encountered opening up is that there are a number of staff members who have identified that they are not willing to work with COVID positive individuals. Since the closure, many of our Whitsitt Center staff have filled in the gap. They've stepped up and provided COVID duties, such as testing and answering calls. So as we go to open up the Whitsitt Center, we're going to have to scale back some of our COVID activities, because that's where a lot of our manpower came from. Reopening at this point is dependent on getting some PPE training and fit testing for N95 masks, which we're in the process of doing. As I said, we have many direct care staff, because they're either high risk or have medical conditions, are not interested in working with COVID positive patients. Additionally, I expect opiate funding to evaporate as deficit reduction decisions are made in the future. So there is a possibility that the AF Whitsitt Center may have to reduce its bed capacity in the future.
Bill, is that the opening of the Whitsitt Center, is that just to help deal with these patients with this COVID-19?
No, this is for substance abuse disorder.
But there's been some of that going on already out there, right?
There are some facilities that are open. The difficulty with providing SUD, especially opiate treatment, is that individuals who are going through opiate withdrawal, when they're in withdrawal, they have flu-like symptoms. They can have, they can have temperatures, they can have flu-like symptoms, they can have upset stomach, and it's very difficult to say, how do we differentiate opiate withdrawal from somebody who has symptoms of COVID-19? So we're going to have to test everybody coming in. And once we have somebody who's in for treatment, if they test positive, they need to stay at the Whitsitt Center. So we have to have the capability to quarantine and isolate the folks in the building. And we have worked out a plan so that we can meet both their medical needs for COVID-19 and also their SUD needs for addiction services.
I see. Thank you. And one other question, before you go on, I mean to interrupt you, but in the very beginning, you mentioned that the death rate in Kent County was, I thought you said 14.
That's 14.
But then you talked about 2 different nursing homes, and are you not combining the?
This is where the statisticians are confounding us. The outbreaks, when we look at outbreaks, death numbers are not associated with the regional jurisdiction, even if they.
So you're saying the 14 is like the general population, and then these other 2?
No, the 14 refers to Kent County residents. So you can be a resident of one of these homes, and if you pass away as a result of being
that
there.
same argument that we talked about once before. If your home is someplace else, but you pass away in a nursing home, the other county gets
Correct.
labeled as you died there. Makes no sense to me, but thank you for the explanation.
Correct. So it's if my counterpart, Dr. Ciatola in Queen Anne's County has, he has plenty of choice words about that accounting mechanism, because we have a number of Queen Anne's County residents in our nursing home. So it's it's still a very tragic situation.
Thank you.
Okay, so that's the Whitsett Center. I also want to mention other health department programs that are facing an uncertain future, so you can be aware of this. We have a medical adult daycare service that we provide services for anywhere from 12 to 18 older individuals. The goal with that service is to keep them out of a nursing home. If they can function at home, they're much likely to have a better outcome for a significantly less cost than you would in a nursing home. The problem with the medical adult daycare service is that it's a very high-risk population, and our physical space at the health department is limited. So we would bring our consumers into the medical adult daycare. We would do activities, and everybody would be congregated together. And the problem there is we don't have space big enough to socially distance everybody to serve the same number. And if we limit the number of people who come in, then we're having difficulty, getting enough billable days for that service to pay for the staffing and the overhead that's involved. So what we're going to do with the medical adult daycare, in all likelihood, we will continue to serve the consumers in a remote capacity. That's where we have our nurses. What we're doing now is our nurses are reaching out to the home to see how these individuals are, if they have any specific needs. We're trying to meet those needs, and we're going to have some involvement with them, but we're not going to have them loading into buses, coming into the health department in the way that we had before. Really, the resumption of medical adult daycare will depend to a certain extent on having a COVID vaccination, which is not something that it's actively in the works, but I have no idea when that's going to happen. So the other health department program that we're having difficulty with is our school dental program. Our school dental program, essentially we provide, we go into the schools, we have a dental hygienist and an assistant who goes in and does screening and fluoride treatments, cleaning and fluoride treatments with these students. Many of them are, Medicaid eligible or underserved, and they don't have a dental home. And so we go into the schools and we provide the screenings, and if something is identified as a problem, then they're referred to a dentist for follow-up care. The dilemma there is that particular program is partially grant funded, but it survives on its Medicaid billing. Each one of those visits, we're able to bill Medicaid for, but at this point, we don't know what the school situation in the fall is going to look like. are we gonna resume full school operations? Is it gonna be a partial operation? We just don't know. So, the school dental program is, in terms of the public health value for the dollars that are spent, are it's well worth the value for that.
Is now exiting.
But, given that we can't guarantee a funding stream through Medicaid billing, and we also had a problem specifically with Medicaid and our supervising dentist. Medicaid said that the dentist that we had been using, and this is Dr. Brayton, who has been absolute trooper for the health department, because he does not accept Medicaid patients, they won't allow him to be the supervising dentist any longer. We have to go out and find a Medicaid dentist, and in Kent County, those are very limited. So we were working in January and in December with Chop Tank Behavioral Health, who we refer most of our patients down to the dental clinic in Denton and Greensboro to expand their FQHC designation to include Kent County for dental services. But unfortunately, the COVID-19 crisis came along, and that has sidetracked that effort. So we may have to put that one on hold for the 2021 school year until we can get that worked out. That's one of the programs that we're having difficulty doing the planning for. So, okay. I'll just go into my closing thoughts at this point. The reopening will continue. It's going to be faster than some people want and slower than others want. So it's, we're going to have to find the Goldilocks solution. And I don't think there's an easy way to figure that out. I urge all of our citizens to continue their vigilance with social distancing and hand washing. Personal responsibility will determine the pacing and the success of reopening. Personal responsibility, and as always, the key numbers to watch are the numbers of new cases and the hospitalization counts. The Kent County Health Department is committed to serving our citizens as we navigate this new chapter of the crisis. Thank you.
Thank you. I just have a question on the testing. The regional is still open until June the 5th.
Correct.
And to get tested there, you have to have a doctor's appointment.
You have to just have a doctor's
Is now joining.
Doctor's
order. You just have to have
okay.
have your physician say, okay, you're having these symptoms or you've been exposed. I think it would be good to get you tested. This is not the no appointment, no doctor's order, no fee, testing that was. They're trying to do that in the central part of the state, and it was so popular that they had to close the line to the testing center as it opened. They had 1,000+ cars lined up to make that happen.
So a person though doesn't have a personal doctor for whatever reason, should they still, if they call a doctor, will they give them this?
They may, and usually what we do with those individuals, we refer them to urgent care. It's just like if you don't have a physician otherwise.
Okay.
We would refer them to urgent care. We have been working with our agricultural laborers who don't have a physician and have had some language problems. Because we have had issues in that community, we have been able to get them in and get them tested. But for those who don't have a primary care provider, the emergency department is an alternative, or the urgent care centers, because if you're not feeling good or you're sick, we want to make sure that you get treatment.
Okay.
So where do we stand with outside dining?
Okay, that's an excellent question. At this point, outside dining is still prohibited, but that is tables and chairs that are somehow associated with with the restaurant. That's not permitted currently. If you do takeaway and you want to have a picnic in a park, that is permitted. And, you know, outside dining is one of those issues that I have a feeling will be, you know, permitted very shortly with, you know, the next announcement. I think that you know, we're moving in that direction, and it is very definitely a you know, something that our bars and restaurants want to have moving forward.
Right, well, the CDC changed that. They said pretty much it's very highly unlikely you get COVID from surfaces, which is a good thing.
Mm-hmm.
And then when I look at all the stats, because I do follow a lot of stats, I follow the Maryland website, it just appears that there's not, and from the information you present here, there's not a lot of people getting this by being outside, like being on a beach or walking down the road or being in a park. So, and being in Kent County, we have a lot of bars and restaurants here that, you know, the bread and butter is when the weather's warm. I mean, I would never want a bar to open where you walk inside a building in a room, but, so you think we should just wait for, are we allowed to discuss this within our own county to make that determination, or do we need to wait for Hogan?
My understanding is that we can enact provisions that are stricter than what the governor orders, but I don't think that we can advance reopening ahead of the governor's decision.
Okay, that was my question. So it goes one way, but it doesn't go the other way.
But I think that's, you know, I think that the next order is going to, you know, make face coverings, you know, optional, and outside dining, you know, available. And I have, you know, seen draft guidance for restaurants late last week, and so it makes me think that there will be something coming shortly on that.
Has not been any scheduled time for any future announcements yet, has it?
Not that I'm aware of, but I'm not the best, you know, I don't, you know, I'm not watching the governor's schedule too closely. That's
I mean, even if these bars or restaurants do open and allow outside dining, I mean, there's still a lot of people that aren't going to pursue going. I mean, it's going to be up to the individual.
I think that the longer lasting impact of this crisis, you know, even if it's permitted, there will be people who will give that a second thought, you know, especially if they're high risk, and that, you know, that's going to be a difficult obstacle to overcome for many businesses, not just the restaurant business.
Yeah.
Are there any other questions for Mr. Webb? Okay, thank you very much. Wayne, Darrell, do you have some comments you'd like to make?
Commissioner, the only thing I would add is that in support of the testing that we're going to do at Public Works, we'll be working with logistics with the health department to get staff and help them support for, I guess, the next 6-7 weeks out there. So we're going to open it up to some CARES funding with some personnel out there to help them do that. That's about the only thing that's changed for us.
Okay. Well, once again, and we keep saying this, and we sincerely mean it. We certainly appreciate everything that both of you have done and all your staff. I mean, it's a real, they've been dedicated, and we sincerely thank you for everything, the extra time, the extra work, the extra thought. I imagine both of you probably had some sleepless nights, or nights that maybe you got to sleep, but the whole time you were thinking about what's next. What should we do about this?
It's been interesting last week or two, is that all the changes and all the developments have slowed.
Right.
So.
Well, please convey to your staff that we appreciate everything that they have done, and I'm sure everybody in Kent County appreciates it.
Thank you.
Okay, thank you.
Thank you.